Hey, what's up? Welcome back. Today we're going to talk about critical thinking. What is critical thinking though? You have any idea? At the end of this video, you will understand what is critical thinking. Let's get into it. Critical thinking. For me, critical thinking is asking questions, analyzing a situation, evaluating the situation with all the information I gathered, and deciding what I should think. That's just a layman way of saying it. Real simple. But let's look at the fancy way of saying it. Critical thinking involves the objective analysis and evaluation of an issue to form judgment. What did I just say? Get the information, analyze the information, check where it comes from, see what it's about, and then make a decision. For nurses though, it means making well-informed decisions based on evidence, clinical experience, and patient information. Not your personal feelings, not your friend feelings, but evidence, patient information, and your experience. So in my last video, we were talking about the nursing process. Critical thinking is part of the ingredients that makes a nurse. You have to be able to think critically. So for example, my friend just come and told me that we gonna get a raise in salary and our salary gonna be like about $200,000 for the year. Wow. That looking good, boy. But you know what? But I just call. I think I'll call the dealership and I will decide to buy a car. I could change my car, and I have to call my husband and tell him we will go on a vacation and thing because our salary going up. That is what we need to do. That is what I think I should do. She just told me it's $200,000. But with critical thinking, would you do that? With critical thinking, what you think your step should be next? She told you the information. She said, girl, we're going to get a salary increase. What you supposed to do? You go and check with HR because you have to validate the information. You have to ask the question. So here she is telling me we get a salary increase, right? So I'm supposed to say, okay, where did you get that information from? First question. So we know it's supposed to come from reliable sources. So the data is supposed to be from a reliable source, right? So I'm supposed to hear she's saying, okay, accounts, HR, our manager. So now I could say, okay, let me recheck that for myself. But not everything you hear, you just follow and just assume and respond. Okay? So you go now and you find out from accounts. Accounts like, no, hell no, you ain't gonna get a raise and pay for the $200,000. But here you were ready to run and go and buy a car and buy a house and go for vacation. So you understand, that's my way of making it real simple. Of thinking critically. You have to think through things before you respond. Okay? So let's bring it back to nursing. So we have a patient that just came in. We said in the previous video, in our nursing process video, our patient was pale, lightheaded, HB at 6.5. So with critical thinking, what do? How do we know this information is relevant? We go and assess the source. So we go to the patient. The patient is showing lightheaded, is saying they're having lightheadedness. The patient is short of breath because you see the patient using the accessory muscles when they are breathing and they're panting. The patient HB, when you check the lab results from the lab that you are, the institute you are, it shows the patient's HB is 6.5. So boom, our information is relevant. It comes from a relevant source. So now I can say, okay, based on the clinical presentation of the patient, based on my knowledge, based on the fact that it came from reliable sources, I can diagnose my patient to say my patient has impaired gaseous exchange, deficient volume, blood volume, and my patient has imbalanced fluid and electrolytes. Based on the information being where it came, what is the information, where it came from, was it reliable, and then I make a decision based on that. That is critical thinking in a nutshell. Taking information, ensuring it came from a reliable source. Then you take that information and you use the information that you know, your nursing knowledge, your pathophysiology, you know in pathophys, and putting it all together and make a decision on what you should do next, which will be what first? We will give that patient oxygen as prescribed by the doctor. Because why? Our patient having impaired gas exchange, shortness of breath, cannot breathe. So what am I supposed to do? I am supposed to help my patient breathe. Critical thinking is just a nice way, it's just a label to make it sound a little technical, but it is seriously asking questions. Why, where, analyze the information, and then make a plan. Okay? So that's it all for today for critical thinking. Remember, whenever you get information, you can apply critical thinking to your regular life. You always take that information, check your source, find out if it's relevant, if it's reliable sources. Then you take the information based on your experience, based on the knowledge that you have, and you make a plan based on that. Do not just take information, use your personal bias, your personal feelings, or anything else that might interfere without it being straightforward, just the information. You just use that information to make the decision. Okay, guys? So remember, nurses do it better. Critical thinking is one of the ingredients that we need to be a nurse. See you on the next video. Check it out. Bye.